For more, I'm joined by Dr. Uzma Syed. She is an infectious disease specialist with Good Samaritan Hospital and director of the Antimicrobial Stewardship Center of Excellence. Dr. Syed, thank you very much for being with us. As we just heard in the piece before you, trials show the AstraZeneca vaccine may stop the virus from spreading by reducing asymptomatic cases. How significant is that?
Thanks so much for having me. So this is great news. You know, we've had so much great development with vaccines and hope on the horizon, given the dire situation we have globally with this pandemic. But the fact that they are showing some data that's showing effectiveness at really decreasing asymptomatic transmission is huge. The main issue with this global pandemic is the fact that people that have no symptoms at all can transmit this virus. And the CDC, the latest data has shown that up to about 50% of transmission is happening from those who are asymptomatic. And that can be further broken down into true asymptomatic and pre-symptomatic people. But this is, really a step in the right direction.
Well, Pfizer and Moderna both report their vaccines are 95% effective. AstraZeneca says its vaccine candidate is about 70% effective overall, but can be as high as 90% if the dosage is tweaked. Help us understand. Can you explain this range in effectiveness?
So it's really interesting. We are waiting for more data. So far what we have is a press release, but it's interesting because they have two different arms in their study. And in the one arm, they were able to use 2 full doses of the vaccinations, which in fact produce less effective immunity. And in the second arm, they used half of a dose followed by a full dose. And that seemed to, really entail higher efficacy and a 90% effectiveness and immunity with that arm. So, there's different thoughts as to why that may be. We don't have a definitive answer for that just yet. There's some theories, is it the fact that, it's how your immune system is supposed to behave naturally when you're first, subjected to a small bit of, the virus, then your immune system gets primed essentially, and then the next time around, it really gets revved up and starts working? Or is it in fact that the 2 full doses are too much, for the body, where your, body is now developing too much antibody to that adenovirus, vector? This is a vector-based vaccine. So there's different theories. We don't know just yet, but we do know that, the half dose followed by the full dose, they're reporting is being shown to be more effective.
So it's interesting, by way of comparison, the CDC says that the flu vaccine is 40 to 60% effective. So, doctor, overall, how confident should we feel in the 3 coronavirus vaccine candidates?
I think this is great news, in a year where we've had such horrible news and everything we get is negative these days. It's really promising. We knew that these vaccines, were, on the horizon, and there was really hope, and we were all cautiously optimistic from the phase 1 and phase 2 trials. The data was very good, but what we really needed was a large phase 3 trials to give us a large subset of population, diverse population, to show that it is really safe and effective. And the fact that we are getting numbers in these ranges, we were aiming to get 60 to 70% efficacy. So to get into the 90 range is really, really reassuring, and, gives us great hope.
So AstraZeneca is saying that its vaccine is cheaper and does not need to be stored at sub-zero temperatures. How will that impact its potential use on a mass scale?
I think that's definitely something that's certainly advantageous to this vaccine. We heard the news about Pfizer earlier and how, they do need cold chain supply, and they have a little bit of intricacies with storage and supplying and transporting those vaccines, whereas this one is a little bit more traditional with regular refrigeration being adequate. So when you think about areas in the world and even areas in our country where people don't have access to large, healthcare centers, they may be in a little bit more rural areas. You want to think about the people that may be most vulnerable and most affected by COVID-19, and we certainly want to make sure that there's equitable allocation of these vaccines. So whether you think globally or nationally, we need vaccines to be available easily to the general population.
Well, given that these vaccines could be hitting the market in record time, some people might be a little hesitant to get them when they become available. Should we be worried about potential unknown risks here? Because as some point out, there is not long-term data, of course, on these vaccines.
I think the important thing that we have to remember is that, all the regulations that we have in place for vaccine development over the years are still being followed, very carefully. And we have to make sure that all the independent boards monitor, they monitor the data, the safety, and they come to these conclusions of whether or not these vaccines are safe and effective. The data has to be released. It has to be transparent. People have to be able to see everything. They have to be peer reviewed. They have to meet these guidelines by the FDA and by the ACIP. So all of these checks and balances are in place. So once all of those requirements are met, and the data is, freely available for everyone to see, I think people can feel more confident that, this is, following the protocols that we normally have in place.
So in the short term here, the CDC is urging Americans not to travel this week for Thanksgiving, but of course, millions of people already have. Doctor, for those who are traveling, what can they do to keep themselves and those around them as safe as possible?
Absolutely. I think, it's without a doubt, we can see that pandemic fatigue is real and people are just tired. And this is the most difficult time of the year with the holidays. And I think people just need to, continue having those good practices in place to really limit, their risks and modify those risks as much as possible. So simple things that we always discuss from an infection prevention perspective: hand hygiene, washing your hands frequently. Mask wearing is probably one of the most effective things you can do to really prevent, further transmission of this virus. As I mentioned, 50% of people, that are contributing to the transmission of the virus have no symptoms. So wearing a mask, keeping your distance from large groups, especially airport travel is tricky. You're around a lot of people. We can see that most people are traveling. And, when you're gathering and merging those social bubbles of yours with extended family or friends, really, try to have that honest conversation with people that you might be in close proximity to before you get together to find out, make sure everybody has in fact been asymptomatic and they haven't had exposure to anybody that might have tested positive. And, once you get into that situation where you are celebrating together, just make sure, if weather permits, celebrate outside as much as possible. Keep the windows open if you are indoors, and try to limit the large crowds for eating. It's when the mask is off, that's when you have the most amount of risk, with the eating and laughing and projecting your voice is when that virus can really get transmitted.
Yeah, it's so easy. You can see how people, as you say, are suffering from fatigue from this pandemic at this point, to let down your guard, but it's such critical advice. Dr. Uzma Syed, thank you so much, doctor.
My pleasure.